Hey, good afternoon, everyone, and welcome back to our third and final session of our Texas Clinical Research Workforce Series. Today, we're going to be discussing worker wellness and retention. I'm Dr. Carolyn Chang from Texas State University. I serve as director of our DHSI programs, Generación STEM and Proyecto Excelencia, and I'm currently a faculty fellow with the Texas State Translational Health Research Center. I'm very excited to kick off our third session in the series, and it remains to be my pleasure to connect with y'all about this very important topic. We're going to start off today by discussing some brief introductions and then diving into some preliminary information about empowering the clinical research workforce, our workers. And then we will be hearing from a current leader on this topic from the ACRP, and we will end off with some group discussions.
Hello, everyone. Thank you for being with us here today. If your internet connection allows it, we encourage you to have your camera on, and then please turn off your microphone if you're not speaking. And a friendly reminder for participants to make sure your correct name is shown in your Zoom square. You can right-click on your square and click on Rename to change your name. If you have a question or would like to share something, please use the raise hand feature so we can make sure to hear from everyone. And as we continue, I invite everyone to make an introduction in the chat. Please share your name, position, and business/organization. Thank you.
Thank you, Shelby. And so we've already heard this several times in this series, but we're gathering together over this series to talk about fostering the health and resiliency of the clinical workforce of Texas. And today we're talking about our worker wellness and resilience or retention. And so we're going to start off directing our attention to a somewhat recent national report around this issue. I say somewhat recent because it is from pre-COVID timeline. The most recent reports that we can find are actually out of Asia, and so I didn't bring them into this conversation for today. And so this report by Buchanan et al. Was published in the Mayo Clinic Proceedings. It's titled Empowering the Clinical Research Coordinator in Academic Medical Centers. And it is a study providing an investigation into various factors associated with clinical research coordinator retention. This article highlights the important role that clinical research coordinators, and I'll extend that to all clinical research professionals, play in the success of the clinical research enterprise. It emphasizes the investment of resources into CRCs for their success. And this study sought out to find what factors were associated with job satisfaction and thus retention for these workers. Currently, literature on this topic is very limited, and it's hard to conduct these studies considering the rapid rate of study structure evolution. And so you can see the citation for this study. This study was done through a survey mechanism where a 45-question online survey was developed by the clinical research team at Vanderbilt University. The survey was administered over a 12-month period spanning fall 2017 to fall 2018. Questions were designed off of anecdotal reports from clinical research coordinators, clinicians, and other clinical research staff at the University of Rochester. And questions address research setting, duration in position, prior experiences, relationships with study participants and research staff, compensation, professional support, additional training opportunities, and opportunities for career advancement. The survey was administered using REDCap, and was administered to a total of 113 participants across the 32 academic medical centers. Here is an example of the survey questions, which were posed using a Likert scale with 5 points, so ranging from strongly disagree to strongly agree. I won't go through each one of them, but it asks questions like, before starting, I understood the role of a clinical research coordinator. There were also questions about working with a PI, so I have a close working relationship with my PI. Questions about workload were asked, working environment questions were asked. Let's see, I have enough time to get all my work done. I was able to contribute to publications and conference presentations. Salary questions such as salary increases were directly tied to my productivity. And so from the 113 surveys distributed, 85 participants completed the survey. Of those that completed the survey, 12 were previously employed as CRCs, 73 were current CRCs. You had about 76 female and 9 male participants. 7% worked exclusively in academia, and 68% worked in a hospital setting, 25% in a private setting. And so they took the survey results and did a regression analysis to look at factors that were correlated to the retention of these employees, so how long they were in their roles. And they identified several institutional factors that were directly correlated to retention. The first category that was highlighted was job setting. Specifically, participants were 9.5 times more likely to have high retention if they worked in an academic setting compared to a private hospital. Salary, unsurprisingly, was also correlated with increased satisfaction in their jobs with good salary. There was a correlation between CRC job level and retention. So for every increase in CRC level, they saw a 3.75 increase in the odds of high retention. Understanding protocol development was also associated with retention. And what was an interesting finding to the authors is they saw that those that had a better understanding of the CRC role prior to their position, those folks were associated with a reduced likelihood of high retention. Additionally, the role of the PI was another major predictor of retention for these participants. PIs significantly impacted CRC retention when considering PIs being collaborative, engaged, and respectful. And so you can see the figures from this article as well. Oh, I'll go back. We're going to come back to some of these findings after our guest speaker segment. But as we'll hear from our guest speaker, I'd like for you to think about the findings and what your anecdotal thoughts or experiences are from your professional position within the clinical research workforce. Obviously, this study was conducted several years ago, and the participants were predominantly from academic and hospital environments. And so I think this group may have different perspectives based on changes in the workforce since this study was done, and also for the Texas region. We're going to transition to a guest speaker. We have Harvonya Perkins, who is the San Antonio ACRP chapter president, providing some information on worker wellness and resilience. Harvonya will mention in this recording that she is literally traveling at this moment, so she graciously recorded a presentation for us so we could include her in today's session.
Hello, my name is Harvonya Perkins. I'm the current president of the Greater San Antonio ACRP chapter. I will be talking to you today about worker wellness and worker resilience. So, as my agenda, I'm going to give you an introduction of myself and who I am. I'm going to tell you about ACRP and what the organization does, and then I will tell you about worker wellness and worker resilience as I've researched on the ACRP website. So first and foremost, my name is Harvonya Perkins. I earned a Bachelor's of Science in Biochemistry from Texas A&M University. I've been a clinical research professional from 2007 to 2023. I was hired by a Phase 1 unit as a PRN phlebotomist in 2007. I later went on to become an assistant coordinator for DGD Research, which was a research facility that specialized in diabetic research, and then ended my research career as it is right now as the director of clinical research at BFHC Research, which I served for 5 years. I've been a certified clinical research coordinator since 2010. I've served in the leadership at the Greater San Antonio ACRP since 2012. I've served as secretary. I've been an educational speaker, and I'm currently serving as president. I'm enrolled in the master's program of biomedical science at University of Incarnate Word School of Medicine, and my goal is to apply to medical school in the fall of 2025, where I would like to be a family practice physician and future PI or principal investigator. So, ACRP. ACRP is the Association of Clinical Research Professionals. It was founded as a charitable organization in 1972. They provide training, certification, and continued education for clinical research professionals. And their vision is to advance clinical research so that it's performed ethically, responsibly, and professionally everywhere in the world. Okay, this is the ACRP website, and I included a screenshot of this here so you could see all of the services that ACRP offers. You know, you have a membership. Your membership gives you access to the website. They have a learning portal where they have educational opportunities in all areas of clinical research. We have the certification page, which shows the requirements and the exam dates for the 6 different areas where you can receive certification. We have a career board where you can look for jobs and post jobs. Insights lets you know a little bit more into ACRP. Events talks about events that are being held nationwide by all different various chapters of ACRP, and then employer resources where employers can get information for training for their employees, or if they want to verify whether someone is a member or is certified through ACRP. Those resources are available there. Certifications. You could be a CCRC, which is a Certified Clinical Research Coordinator, CCRA, which is a Certified Clinical Research Associate or Monitor, CPI, which is Certified Principal Investigator, Certified Professional. This is for people like regulatory, data management. It gives a broad view of the world of clinical research that's not narrowed by any certain role. certified project manager, and certified medical device professional. So, worker wellness. I did a search on the ACRP website and I had 190 results that were found. We have different pages and events and things that were listed, from online trainings to conference. We have an annual national conference, so either conference replays, home training and home study. That's from the monthly magazine that is published by ACRP, keeping us abreast on the latest things that are and latest changes that are occurring in clinical research. So I did a view of a conference that was done, a presentation that was done this May in Anaheim, California by Dr. Romy Mostag. So Dr. Mostag, she did a presentation that was entitled Changing Perspectives on Clinical Research Through Mindfulness and Professionalism. She is the Chief Wellness Officer for Wolf Lodge Corporation, and she also has a book. She studied mindfulness, and she's a creator of material, educational material for mindfulness. So she stated in her presentation that to improve worker wellness with mindfulness, she has a test where you can test whether you have a busy brain, and it will categorize you into 4 different categories. And then she provides steps to reduce busy brain and increase mindfulness, and strategies for incorporating worker wellness into an organization. So I took the exam, I scored a 61, and I am experiencing burnout, which means that I'm facing severe stress, potential burnout, which is affecting every area of my life. That's very realistic because I added this presentation onto an already busy schedule when I'm preparing to leave for a trip on tomorrow, which is today for y'all. I'm actually traveling by plane during this presentation, which is why I am pre-recording it. And so this does adequately assess where I am right now. So this is her recommendations. Her recommendations is for me to start off by making sure that I'm getting enough sleep. Busy brain is exacerbated by an irregular sleep schedule, and one of the questions did ask me about my sleep schedule, which I have not been getting enough sleep. So this is the recommendation for me to schedule my sleep time, and that for 1 week that I go to bed and wake up at the same time every day. And this is just to set my circadian rhythm, that I do a digital detox before going to sleep, and 30 minutes to an hour before to stop my digital devices. Also to do a brain dump, and this is on pen and paper, where I write down all of my thoughts, all of my ideas, things that are rattling around in my brain, so that I can calm my mind, and then to go into a meditative state to focus and to help clear my mind and get a state of tranquility prior to sleep. So the third point that I had is, how do you enroll this into an organization? And so Dr. Romy had these steps that she used at her organization. First, to have a complete buy-in by the CEO and the executive leadership. 2, to have a dedicated wellness officer who creates and teaches programs on mindfulness. That's the role that she serves for her organization. identifying and training wellness ambassadors throughout the company and honoring their hard work, and then measuring outcomes in associate opinion surveys and sharing these results across the organization. By doing these steps, she has a 70% adaptation into her organization, which included over 100 hotels in the United States and Canada. Worker resilience. So on worker resilience, I did a search on the ACRP website. I have 47 results, various different content type, and I selected another recorded conference entitled Resilience is the Key to Thriving as a Clinical Professional. So this was a presentation that was done in November of 2019. It was not at a conference per se, but it was at the ACRP Central Virginia Chapter's 9th Annual Fall Symposium. And so Barbara Vandershaley, who serves as Clinical Trial Manager at Leidos Biomedical Research, did this presentation. The summary of her presentation is as follows. The steps to building worker resilience is to examine how you function in your professional life, change worrying to I am prepared for whatever you were tempted to worry about, set goals to address those, and then state those publicly so that you have accountability to meeting those goals. Share knowledge freely with others throughout your organization. That's a great way to build resilience. Communication is improvement on every area in every organization. Keep your sense of humor. Instead of focusing on mistakes or errors or worry about mistakes or errors, keep a sense of humor. Remember your why and make it fun. And then another important point that she made is never underestimate the value of taking the occasional mental health day. In clinical research, we tend to have deadlines and things that come up that require our time or divert our time. And so it's good to, after going through a period of time of crunch, to take a mental health day. I know I did that as director in my organization. I had permission from the owners to have a early release day, unofficial early release day once a quarter, that I could let the staff go early after we have had met a goal, or if we've had a really stressful time and I could tell that they needed some time off. And that was also another way of building worker resilience and also being sensitive to the needs of the workers in your organization. So that's the end of my slideshow on worker resilience and wellness. If you would like more information or you had any questions, if you would like to be added to the email blast to know of our events for the Greater San Antonio ACRP chapter, please feel free to email me at harvonya@hotmail.com. And if you want to look at more information that's available on the ACRP website, I have that included there. For some of the trainings and stuff, you do not necessarily have to be a member of ACRP, but you do have to go ahead and make a profile. Thank you so much for your time, and I hope you have a great afternoon.